If you're watching this, chances are it's because a new football season is on the horizon, and I'm sure all you players and coaches are ready to get back out on the field. But first, I'd like to take this time to talk about the issue of concussions. If you break a bone, sprain an ankle, or pull a muscle, chances are it's just a little bump in the road without any long-term effects. The same cannot be said for head injuries, and more specifically, concussions. Concussions can lead to long-term symptoms that not only affects your athletic career, but your overall life. Onset cognitive decline is one of these long-term symptoms. In other words, your mind will not work as well if you sustain multiple concussions. Before we discuss how to treat and prevent a concussion, we need to explain what it is that we're dealing with here. A concussion is defined as trauma affecting the head or body resulting in transient neurologic deficits or symptoms. The common symptoms directly after a concussive impact include slow visual and motor responses, confusion or a lack of focus, lack of coordination, slurred speech, nausea, dizziness, and in some cases even lack of consciousness. Here's a clip of Rams quarterback Case Keenum sustaining an impaired concussion. Notice how he is uncoordinated and is struggling to get up. Players, if you feel this way after a hard impact, I strongly advise you to stay on the ground until the medical staff or athletic trainers check you out. Getting up after a hard impact like that can only worsen your symptoms. Also, you may have noticed that Keenum's teammates try to pull him off the ground, urging him to get up. This is terribly wrong. Advise a player that looks like he's a little woozy to relax and stay on the ground. Don't do anything like slapping the back of their helmet and telling him he's alright. This only makes it worse. And coaches, when a player is obviously confused or shows even small signs that he may have been concussed, do not encourage players to stay in the game. Refer the player to an athletic trainer so they can make an informed decision on the player's well-being. Notice how the player remained in the game after he is noticeably confused and dazed. This is unacceptable and extremely dangerous. Doing this leaves the player susceptible to second impact syndrome or SIS. SIS, or a concussion after another concussion, leads to severe brain injury and sometimes even death. After a concussion, a player is 3 to 6 times more likely to suffer a second one. Let me ask you a question. Would you rather sit out a couple weeks and return perfectly healthy, or stay in the game or practice, sustain a concussion, and not be able to think or function the same ever again? Well, that's the risk you take if you choose to stay on the field after sustaining a concussion. Concussions can be avoidable while playing if you tackle correctly. Coaches will go through the proper way to tackle out on the field. The biggest takeaway is to always keep your head up while tackling. Leading with your head down leaves you more susceptible to concussions and other serious injuries. Just remember that concussions are dangerous. Therefore, it is imperative that you play safe and cautious. Always look for signs of a concussion in yourself and your fellow teammates. With that being said, thank you for your time and good luck this season.